Assalamu alaikum. Hello, I hope you are doing so fine. I am Dr. Tosifuma and I am here discussing with you the art of pediatric history taking. Pediatric history taking is quite different from taking history from an adult patient, and the foremost thing here is that there is an attendant always accompanying the child. So you greet the child and the attendant with a smile and sit at about 1.5 arms length away. Introduce yourself that I am Dr. Tosifumar and I'm a pediatrician with an 8-year experience. What is your name and how are you? Be loud enough so that you are heard easily. If your child, if the patient who is a child is an age where he may communicate with you, do ask his or her name and age and ask from the attendant the relationship with the child. It is good to carry a toy, a rattle, or a storybook to gift to the child. Prefer not to give eatables like candies because the child may have some storage disorder where you may not give that particular candy or chocolate, or the child may have celiac disease even, or simply so that the attendant may not like you giving some eatable to the child. You may ask which language the attendant is comfortable in giving history. They may be comfortable in speaking Punjabi instead of Urdu or English. Do not place your examination kit on patient's bed. Place it on the side table. Do not open your examination kit on the patient's bed. Open your examination kit on the side table. We start off with biodata. It's very basic that we ask the name of the patient, their age, gender, name of father for the record purpose, address, the contact number, and the relationship of the attendant, who is obviously your source of history. Next, if the child is admitted, the date of admission, mode of admission if it was outpatient department, the follow-up clinic or the emergency department, and the time of admission. Next, ask the presenting complaints. What brings you to the hospital? अस्पताल कैसे आना हुआ? The complaint one, if you are writing it, should be written above, that is having the longer duration. And the complaint below has the duration shorter than the first complaint. For example, the child may be brought to you with a history of fever for past 10 days and ear discharge for the past 1 day. I do not recommend you to write down all of the history that you are taking. Well, I do recommend that you write down all of the biodata and at least the presenting complaint along with the duration, and next you move on to this approach where you have the biodata here above, the presenting complaints here, and if the mother has told you the diagnosis here, that let's say you say what brings you to the hospital, and the attendant, if let's say she's a mother, and in all of our upcoming discussion, if I say mother, it will refer to the source of the history here and the attendant who is accompanying the child. She may tell you, doctor, my child is a case of nephrotic syndrome for the past 5 years, right? So you simply write it down here, nephrotic syndrome. Let me zoom in here. And she tells you that he's now having fever for the past 5 days, vomiting and pain abdomen for the past 2 days. Now, these two presenting complaints should bring you to a differential diagnosis for a known case of nephrotic syndrome. Well, it may be urinary tract infection, it may be spontaneous bacterial peritonitis. So this margin will be used for this purpose. This margin here that I asked you, I recommended you to draw. Here you will write the main diagnosis and the diagnosis now for a chronic case, and only the main diagnosis for the acute case that you will make in the end of history taking along with examination. But for the time being, if the patient is a chronic case and you come to know the main diagnosis, let's say that it patient is a diagnosed case of chronic kidney disease, or the patient is a case of cystic fibrosis. Next, you say mention here the issues, all of the issues identified while taking the history, and any other point that you wish to ask later from the mother. Again, I tell you that if I say mother here, it will be she will be the source of history being attendant in our discussion here. Once you have asked the presenting complaint, give 3 minutes to the attendant to speak more about the condition. Try not to interrupt him or her so that they may speak freely. Next, we ask history of presenting illness and a simple mnemonic to elaborate every complaint is OD para. That stands for onset, duration, progression, aggravating factors, relieving factors, and associations. The onset, we know that it may be sudden or gradual, and the duration, you know, it may be in the years, months, days, or hours. The progression of the presenting complaint over time, if it has been worsening or having a spontaneous resolution or resolving with medications. The aggravating factors that aggravate that complaint, the relieving factors which give a relief, and the associations. Well, a complaint may have many associations. That is totally up to you or up to the attendant if in what way you or the attendant wish to elaborate it. The systemic review, well, you give a head to toe recap of all the systems so that you come to know the known or unknown associations or relations of that complaint. You ask about every system, but shortly. I feel that it is good to ask it just after HOPI. Next, you ask the investigations that have been done now, the treatment offered now, and the progress now. Investigations now, a simple way to ask them is what labs have been done, how has the patient been investigated, and a knowledgeable, educated, or an observant attendant may tell you that some blood investigations have been done, some urine investigation, some ultrasound scan has been done, a chest X-ray has been done, a lumbar puncture has been done. And next, you may ask them what was in the reports. And if they are knowledgeable enough or if they are observant enough, they may tell, or if their level of education is so, they may tell you that in the complete blood count, I have been told that there was low white cell count. Or they may tell you that the blood reports were all normal. That is what I have been told. However, I have been told that in ultrasound scan of the tummy, there has been some water in the tummy of my child. Or they may simply tell you that I have no idea what was in the reports or I have not been told. Next, what treatment has been offered so far? And again, a knowledgeable attendant or an observant one may tell you that intravenous fluids, some injectable medications, some suspensions have been given. So do not ask a leading question in any part of the history. Do not lead them, just ask them. Ask open-ended questions so that you do not draw conclusions for the attendant and for the treatment. However, you may ask later if you do not get the desired answers or the desired um, uh, bits to fit in the whole scenario. You may ask them, was some syrup medication in the syrup form given? Was some medication given in the powder form that needed to be formulated and given later on. Well, some injectable has been given or some IV fluids, and they may tell you, yes, yes, doctor, I was advised some medication suspension, and I needed to make it out of a powder form to make it into a liquid form. I needed to formulate them into a suspension. Or doctor, the kid has been advised some nebulizations, etc. Next, you asked what has been the progress. The progress here is referring to the presenting complaint. Okay, the initial most complaint, what progress has been so far after you followed the treatment that was offered to you. Next, we move on to the past history, which may be the actual history in case of a chronic case. You may ask, what was the presenting complaint back then? Well, doctor, my child was diagnosed with nephrotic syndrome about 5 years back. Okay, what happened? What brought to you the hospital back then? They may start off by telling you, well, the child was doing fine when for the past 3 or 4 days we had noted that he's having early morning periorbital puffiness, and we moved on to a checkup from a local doctor who advised us this. Now, during this time, you may or may not interrupt the attendant. If they are giving you some valuable points in the history, do not interrupt them. You may not necessarily jot down every bit, every word they are saying, every sentence they are saying, but if they are telling you something very, very valuable, just mention that word as a key word. But I told you earlier that you need to mention, write down all of the headings of the history. For example, the headings would be HOPI, systemic review, investigations now, treatment now, progress now, past history, actual history, so that you do not miss anything. Okay, after presenting complaint back then, ask them the history of presenting illness back then, the systemic review back then very shortly, the past history, which may actually have an overlap with the past history you asked earlier, the investigations done back then, the treatment that was offered back then, and the follow-up and the treatment back then and the progress that was back then. Okay, so past history is actually having all the same headings that the current history starting with presenting complaint is having. HOPI, systemic review, past history, investigations, treatment, progress. Only that it is investigations back then, treatment back then, progress back then, which was investigations now, previously treatment now, and progress now. Further moving on, just say this mnemonic again and again so that you remember it as one sentence. It is Cham, Bivand, Skiffs. Cham, Bivand, Skiffs. Cham, Bivand, Skiffs. It is double C, Cham, Bivand, and Skiffs. The Cham stands for compliance, complications, hospitalizations, activities of daily living and monitoring. Compliance, complications, hospitalizations, activities of daily living and monitoring. Vivant stands for birth history, vaccinations, exercise or physiotherapy, nutrition, and the developmental history. SCIFS stands for screening, knowledge, impact, family history, follow-up, and the social history. CHAM, Vivant, SCIFS. Compliance, complications, hospitalizations, activities of daily living, monitoring, birth history, vaccinations, exercise or physiotherapy, nutritional history, developmental history, screening, knowledge, impact, family history, what was F, follow up, and socio-economic. So the compliance with the treatment offered, how do you ask it? You may ask who purchases the medicines, who administers the doses to the child, how often the medicine is purchased. Here you may have an idea if they are telling the truth. For example, if a medicine pack has 30 tablets and they are to be given once daily to the child, and that was purchased 2 months back, well, the doses have been missed. Furthermore, about compliance here, you may ask if um, the child administers the drug himself, for example, and an older child may be administering insulin themselves, or um, uh, if an expensive drug has been purchased or not purchased, or the price or even of the expensive drug, you will then have an idea if they are actually buying the drug and giving it to the child. Next, we move on to the complications. These are the complications of the disease and the complications of the treatment. The complications of the disease, let's say that the patient is having which disease? Celiac disease. And here, the complications that you may need to ask, for example, the child pertaining to short stature, you may ask the history, or relating to, um, for example, the pubertal delay, if they are experiencing it or observing it, etc. And the complications of the treatment, for example, if some medication such as delta cortil was advised in nephrotic syndrome, and you have asked them about any complication, and they tell you that yes, the child is getting chubby now, or if any nebulizations have been advised, and they tell you that he gets very anxious once this nebulization with salbutamol is given, or feels palpitations, etc. Next, hospitalizations. So you ask them, how many times was the child hospitalized? Where was the child hospitalized? What was the duration for every visit? And what were the presenting complaints? Who paid for the hospital charges? Was it the government paying it? Were the admissions free? How many emergency department visits were actually there? And what was the outcome in every hospitalization? Was the child admitted, or discharged home? Here, you may elaborate to the extent you feel it needs elaboration. Activities of daily living. A good mnemonic is breath, dressing, eating, ambulation, toileting, and hygiene. So, for a child with, let's say, who is now having um, some issue related to joints, for example, SLE case, or for juvenile idiopathic arthritis, are they now able to dress themselves? Do they eat themselves, etc.? Ambulation, toileting, hygiene, right? Monitoring. For example, a case of diabetes mellitus may have need to monitor blood glucose. So do they have record of blood sugar measurements? How often do they measure blood sugar? Or if a child is having nephrotic syndrome, let's say, then monitoring related to urinary protein. Do they know the technique to boil the urine and to see um, how much protein could be in the urine, or monitoring? Furthermore, let's say the asthmatic child, he may have a peak expiratory flow rate meter with them. Do they know how to use it? Or furthermore, any other disease that you may think needing monitoring? Think for yourself also. Well, I hope so. Such examples are quite enough. So, compliance, complications, hospitalizations, activities of daily living with mnemonic, and monitoring. It is um, quite good if you extend your uh, thinking beyond simple monitorings I have told to, let's say, record maintaining for a case of thalassemia, where They may have serial serum ferritin measurements, right? Or HbA1c for a case of diabetes mellitus. I hope you are having a good idea. You need not writing everything under these headings, but you need writing these headings at least so that you do not miss anything. Once you have taken the history, you may write down everything you have asked from the attendant. If you are taking a bedside history for your actual hospital duty, you may need to write these down in the chart with elaboration, or into your computer if you are using soft application platform, or if you are preparing for an examination, then it is quite good that you write only the headings at least. Do not forget what you have to ask, and once you have to narrate it to your examiners, you do not forget it. However, if you are writing it, doing it for the sake of your duty, it is very, very good to elaborate each of every of the heading later on. For prevent the birth history, the antenatal history, natal and the postnatal, in the if the child is having some disease, having some condition where birth history needs elaboration, then you must focus here. For example, a child who is preterm, who was born preterm, or a child who is a case of cerebral palsy post birth asphyxia, it is quite good to ask for good antenatal history, good natal history, and the postnatal history. In the antenatal history, well, you may ask how many antenatal checkups were done, where these were done, what labs were done, what was in the ultrasound findings, and how many times blood sugar had been checked antenatally, and prior to conceiving, was folic acid taken by mother, and what were the multivitamins that were taken during the pregnancy, etc., etc. You you may ask relating to the planning for the birthplace, or the planning for delivery, and if tetanus shots were given, or if the baby was born preterm, about the steroid injections. Then the natal events was um, it was SVD or cesarean, or about the natal. Furthermore, during the natal events, did the child have an immediate crying, needing only the routine care, or if the child required resuscitation at birth, did the child require admission after birth, if the child fed um, normally after if the child was able to feed right after birth, or if required admission and could not accept orals for many days, was some pre-lacteal given to the baby, how when was the child discharged home if admitted, right? You need to elaborate it to the extent you feel reasonable according to your case. Vaccinations, if the child is following the EPI schedule, extended program of immunization, then how many vaccines have been given? Are there any missed doses? Or what additional vaccines have been given? The child may have a disease where, have a condition where they need physiotherapy or some exercise. You may ask accordingly here. The nutritional and the feeding history, it is quite good to ask what foods were offered to the child during the past 24 hours, and if the child did accept and tolerate those feeds. And it is also quite good to ask to calculate calories in that food items. And furthermore, you need to ask the developmental history. Again, development should be elaborated to the extent you feel reasonable for the case you are dealing here, right? For a child who is having a normal development, you may superficially ask about here, but if a child is having some post-meningitic sequelae, or if the child is a case of SSPE, or if the child is a case of, let's say, some storage disorder where CNS will be affected, you need to ask development. Let's say if child is a case of subacute sclerosing panencephalitis, I hope that you understand that asking an elaborate development history is quite essential. We are moving further to SCIFs: screening, knowledge, impact, family history, follow-up, and the social history. Well, screening. Do we need to screen the other family members or the siblings? Let's say a case of tuberculosis has been diagnosed. Let's say it's a diagnosed case of Wilson disease now. Was screening offered to the siblings? Do the siblings require screening? Or I hope you are having an idea. This heading, if you have written it in your notes, I hope you will not miss it. Knowledge. Ask about knowledge about disease, about the medications, the treatment options, right? And the complications of the disease and the complications of the treatment. The knowledge of the attendant, and for an older child, the knowledge of the child about the disease, the treatment options, what they should do, what they should not do. Here, this is an umbrella of the heading of knowledge, right? It refers to the knowledge of the attendant, knowledge of the child, the patient himself or herself, and knowledge about the condition, the treatment options, the complications of the condition and the complication of the treatments, or the things they have to avoid or the things they have to do. For example, you may ask about diet, knowledge about diet in a case of Wilson disease, and the family may and they should tell you that we are asked not to eat chocolates, dates, nuts, etc., etc. Or regarding a case of diabetes mellitus, similarly for a case of celiac disease, right? And some storage disorders where they may tell you that we have been asked uh, that we must not eat this or that. And for example, knowledge about a case of diabetes mellitus, that we have been told that at this age evaluations of eyes should be done, or for a case of GISA that we have been asked to go for eye evaluation 6 monthly, right? This is actually the knowledge about the condition or what can go wrong. Or for a case of Down syndrome, let's say that we have been given this follow-up plan, that at this stage we have to go for this investigation, at this age of life we have to go for this screening, etc., and etc. The next is the impact of this condition, the impact on the patient, the impact on parents, the caretakers, the siblings. Ask about the impact on schooling and social life and on the activities of daily living. Next, we ask family history, starting off with consanguinity. If they are first cousins, the parents, the father and mother are the first cousins, because genetic disorders tend to linger more in consanguineous parents. How many siblings the patient has, if there is a history of any sibling death, or let's say if a child is a case of congenital heart disease and there is another child with congenital heart disease, it may be essential to ask them, ask the parents if there is another child, and they tell you that yes, there is another child with a congenital heart. So in the end, when you are managing the patient, this is the issue, that you will counsel them that the next born child may have this percentage or increased risk of congenital heart disease in the another sibling. So as you get to know the issues here, you will mention those issues in that margin we have initially written here because somewhere in the management those issues will be addressed. Again, in the skiffs, the follow-up, where the follow-up has been advised, in which follow-up clinic, which lab tests were advised to be done at the follow-up, or if some medications need to be changed on the follow-up. For example, a case of um, epilepsy may need to be asked to come on follow-up to get their medications changed according to increase in weight. The doses may need to be increased. Or for example, case of hypothyroidism may need changes in their thyroxine, or for growth monitoring in all of these cases, celiac case, cystic fibrosis, primary malnutrition, tuberculosis, etc. Right? So the purpose of follow-up is to give a holistic care to the patient again, to manage all of their issues again, relating to the laboratory related issues, the labs related issues, or the general patient care. For example, addressing of a good follow-up, in my opinion, a questions in a good follow-up that we will need to ask that where your follow-up is being done, and do they check weight and height on every visit, or what lab test they do on every visit, what have you been told to um, get as a lab test in the next follow-up visit, etc. Right? The social history, well, you may ask if they live in their own home, what is the income of father? Is he able to afford the drugs and the labs? Do they need financial aid? It is the right to ask from the state for financial aid, and it is the duty of state to support them. So you ask here the social history. How many families live in the home? How many of them are earning? How many family members are earning there? If they own a fridge or a bike at home or a car, their water for drinking, and the sanitation conditions, and anything that may be related to their cultural norms, like not eating meat, strictly vegetarian, etc., etc. This is here a recap. We started off with biodata, then presenting complaint, HOPI, systemic review, investigations now, treatment now, progress now. Past history, or the actual history of a chronic case, the presenting complaint back then, HOPI back then, systemic review and past history back then, investigations back then, treatment back then, and the progress back then. And next we moved on to CHAM, VIVENT, and SCIFs, which stated for compliance, complications, hospitalizations, activities of daily living, monitoring, birth history, vaccination history, exercise or physiotherapy, nutritional history, developmental history, screening, knowledge, impact, family history, follow-up, and socio-economic status. So again here, I'm telling you that once you have asked about presenting complaint, a differential diagnosis must come to your mind against which you have to complete your history of presenting illness. And finally, in the end of history of presenting illness and systemic review, you must understand what is the diagnosis here, right? Well, it is actually a Sherlockian approach. You dig into every complaint and association of that complaint, not ignoring the minor details. The minor details are where these lead you to the actual problem, the issues, and then the diagnosis. This whole of the history, that this discussion is actually a tool that I am giving here you, and it will actually fit into every of the problem where you will come across in your practice. Just change it according to the situation you are getting into, and I hope if you are following all of the headings you will not miss anything. Finally, listen to your patients. They are telling you the diagnosis. Good luck to you.